Hello viewers, welcome to another interesting episode of your health-friendly program, Health is Wealth on mccptv. I am Goodness Victor. Thank you to those who have been watching our videos. We appreciate your likes and comments. And if you are yet to subscribe to our YouTube channel, please do that now. So on today's episode, you may be surprised that we are talking about dental health, mouth odor to be precise. This topic may be kind of trivial to so many people who are watching this program today, but I must tell you, mouth odor is a problem in our society today. And as you all know, most of our topic we talk about here comes as a request from our viewers out there. So you too can drop a health topic you want us to talk about on our next video. Mouth odor is an unpleasant smell that comes from the mouth, also known as bad breath. This smell is always persistent, offensive, and strong. Almost everyone experiences mouth odor once in a while, but to some people, it is a chronic condition that occurs frequently. Some individuals pay proper attention to their dental health. Some brush their mouth twice daily, which is recommended, but some don't even brush their mouths in days. Sometimes, some people wonder why it is very difficult for them to have close conversation with people without being ignored or giving some distance. This could be so embarrassing, especially in this part of the world. You may want to talk to somebody and the person keeps moving away from you, and you may be wondering why. Check yourself, you could have a bad breath. Let's take a look at some of the causes of mouth odor. Please stay with us.
Health is wealth.
According to research studies, poor dental hygiene is the major cause of mouth odor. When we eat, bits of this food get trapped in the teeth and tongue, and over time, bacteria grows in these bits of food debris, thereby releasing the foul-smelling odor. Dry mouth also causes mouth odor. The saliva helps to cleanse and remove leftover from the mouth as well as aid digestion. But when there is limited amount of saliva in the mouth, it can result to bad smell. Bad breath are also caused by gum diseases when there is a buildup of plaque in the gum. Toothaches and other dental issues also contribute to bad breath. Inflammation of the mouth, nose and throat infections are also associated to temporary mouth odor. Bowel obstruction can cause our breath to smell like feces. Some of the food we eat also leaves us with mouth odor such as garlic, ginger, and onion. Mouth odor can also be as a result of other health conditions such as acid reflux, diabetes, liver and kidney diseases. Excessive smoking and use of tobacco products causes havoc to our dental health, leaving offensive smell afterwards.
Health is wealth.
Welcome back, viewers. Having a fresh breath can make you feel great. Yes, it is also a sign of good health. One of the benefits of having a good oral health is self-confidence. You'll be able to laugh and smile while having a close conversation. Another benefit is comfort. You will not only be comfortable, even people around you will be comfortable while interacting with you. And when you keep your dentals healthy, you will also be far from having toothaches, tooth decay, and other dental infections. Just for our health benefit, we had a chat with a dentist to educate us more on the matter. Let's take a look.
Health is wealth.
Hello guys, you're still watching Health is Wealth on mccptv, and today with me is Dr Ike Emily. He is going to share with us some vital information on the topic today. You're welcome, doctor.
You're welcome. Thank you for having me.
Good to have you.
Thank you so much.
Talking about dental care, we'd like to know some of the possible causes of mouth odor.
Before we talk about the causes, I would like to talk about what it means. Mouth odor, otherwise known as bad breath, is a very serious oral health issue that has affected people to the extent of affecting them psychosocially, and as a result, their performance at their job place is affected, their interaction with the people is affected, And so, what are the causes of bad breath? There are many causes, and these causes can be localized within the oral environment. It can also be as a result of underlying systemic conditions.
Okay.
All right. However, we could also have it as a part of our normal functioning as a human beings.
Really? Can you explain that to us, please?
Yes, we call it physiological halitosis. What do I mean by that? You go to bed, you wake up in the morning with a mouth odor.
Okay.
Because your mouth is non-functional within the period of sleep.
Yeah.
And because the saliva is not flowing, the bacteria that actually bring about mouth odor have the opportunity to thrive.
Sorry, I would like to know, are you trying to say that it's normal, even while you brush your teeth twice daily?
Yes, it's normal. And it occurs when your mouth is not functional, like it is at rest. Okay. Just like you having a nap and you wake up noticing that your breath is bad. How does this happen? Usually the saliva in our mouth has a cleansing effect.
Yeah.
And it flushes bacteria away, the germs that actually lead to this bad breath. So when you are asleep or when you have not talked for some time, the saliva is not flowing. So these bacteria naturally living in our mouth have the opportunity to thrive. And what do they do to show that they thrive? Usually we have leftover in our mouth when we eat. Okay. No matter how much you brush, you cannot clean everything.
Oh, really?
But it's good to brush, at least to
reduce.
Yes. Get the leftover in your mouth removed as much as possible. So the leftover in the mouth, the bacteria living in our mouth act on them, all right, and the deposit products which are odorous.
Okay.
And these products are called volatile sulfur compounds.
Okay.
Volatile means they can evaporate.
Okay.
That is what happens. So when you wake up and start talking over time, with the saliva flowing and doing its cleansing function, you find out that your good breath will come back.
Okay.
Because in some people actually what they do is that when they wake up from sleep in the daytime, they actually brush.
But there are some people that no matter how they brush, no matter how they cleanse their mouth, maybe with salt and water, the bad smell keeps coming.
We will come to that, and that is when we are going to talk about the other causes.
Okay. Can you tell us that?
All right. I haven't explained what physiological halitosis is, which is normal living with that. When you brush, like when you just go to bed, sleep, and wake up, you notice that you have bad breath.
Yeah.
All right. Then what are other causes?
Okay.
We have the ones that can be caused as a result of social habits, oral habits.
So what do you mean by that, please?
Like social behavior, smoking.
Okay.
Intake of tobacco, either in terms of smoking or in terms of snuffing.
Okay.
Alcohol consumption.
Okay.
Then we have other health conditions that can actually lead to bad breath.
Okay.
We talk about the infection of the respiratory system.
Okay.
That is the system that is involved with breathing.
Okay.
And then when you have, because the mouth is connected to the respiratory system, when the system is infected or has a disease, it can, bad breath could actually be one of the manifestations of it.
Okay.
And so it becomes a gateway to knowing that actually you have underlying a systemic medical condition. We also have other causes.
Okay.
Other systemic causes may include diabetes.
Okay, diabetic patients.
Yes, diabetes mellitus. People that have diabetes. Because they cannot utilize their sugar, they tend to rely on fats. And the breakdown of these fats to give them energy will lead to production of some chemicals we call ketones. And you see the ketones being expressed in their breath.
Okay.
Okay. Then also, the disease of of the intestine, gastrointestinal tract. It has been shown that people that have ulcer can also have a bad breath.
Okay.
Yes.
Are you trying? Is it something like obstruction of bowel movement?
Obstruction is one.
Okay.
Obstruction is one of them.
Okay.
Because when you do not have this food substance flowing, they accumulate in the tract. Bacteria, acting on them, causing fermentation, and the product of this breakdown is the products that can actually be expressed through your breath.
Okay, doctor, thank you for that. Before we call it a wrap, is there any healthy tips or anything you have to say to our viewers out there?
Okay, one is good oral hygiene. You will continue to emphasize it. Prevention, they say, is better than cure.
Exactly.
And then your toothpaste must contain fluoride. These are the things you have to check in the market when you go to buy toothpaste. It should contain fluoride. Okay?
Yeah.
And then coming to dental clinic to see a dental practitioner 6 monthly, at least 6 monthly for routine dental checkup.
All right. That was a wonderful one. Thank you for taking our time to grant us this interview. And I hope when next we come, you'll be able to give us more sessions like this.
It's my pleasure always.
Yeah.
It's my pleasure.
All right, guys. You all have heard it from Dr. Ike and Emily, and I suggest you take this advice seriously. The show continues. Please don't go away.
Health is wealth.
Here comes the end of today's episode of Health is Wealth on MCCP TV. If you are yet to subscribe to our YouTube channel, please do that now and punch the notification bell to get notified on our next video. Keep a tab with us on our website at mccp.tv. Make sure you like this video, drop a comment and share to your friends. Till I come your way next week, I am Goodness Uto. Please stay healthy.